technical projects could have a huge impact. So Salam and I talk, gosh, almost every other week about helping his medical school get back together. And I don't know where that goes, but we'll see. Yeah.
Do you see any hope for changing the international aid system? And what I mean by that is, like, I think so much of the aid system is set up as, treat the symptoms and that's it. And that doesn't work. Like Partners in Health works at on the social aspect of, what causes these problems? Why are these diseases here? When I was in South Africa, we were working in a township and with HIV/AIDS families, and so PEPFAR delivered all these drugs, all these ARTs, so to help the AIDS patients. But the reality was most of them couldn't take it because they didn't have good enough nutrition. They didn't have food, and so this system of delivering aid that addresses the surface problem but doesn't address the reality of what's causing this problem. And I think that is so true in Haiti with so many of the NGOs, that it just treats surface things, and the root causes of what is creating these, particularly the poverty and malnutrition.
Let me try two answers from my perspective. One, if students especially haven't grappled with Naomi Klein in her book called The Shock Doctrine, just about the money that's made in aid. And I think until there's less profit in disasters, man-made or otherwise, that things won't necessarily change. There's a self-reinforcing system that her opinion encourages crisis. And if you follow the money that's spent in Iraq and Afghanistan and how that comes back to us, it's a shell game. And so that's, I think, big picture. On the more local, programmatic level, I think the realities that you've seen and know about, and probably and many people would have similar stories about how things don't work. The hopeful, and I'm not always hopeful, but the hopeful way to think about, I think, that question from programs and from actors and NGOs and advocates, students, or whatever. A program that was intended to provide antiretroviral drugs to folks in some place in South Africa could be done in this vertical, technical, this is what we're doing, this is all we're doing, here are the medicines, see ya in 6 months. That same intervention could be done, and could be done better, with a package or a breadth of services that reinforce what's already there, that strengthen systems that exist, that actually can raise the level of care in other ways. And so one of the small papers we wrote some years ago and still rely on quite heavily is a description of a program to provide HIV drugs in a community, but then showing through that we increased prenatal visits and increased vaccination rates and doubled our TB program, and so had all these positive spillovers. So I think the shakeup should be bigger, and I think it should be really around who's got the money and where it goes and that kind of investment question. But even those programs, I think they can be leveraged toward the good if you push the limits a little bit, or implement them in ways that are reinforcing, and use in Haiti we call it the Schwalbatan, it's like the horse you ride into battle. So HIV, I've worked on HIV now solidly for 7, 8, 9 years, and did not ever think I would or should, but it's the disease that's helped us organize, get started, find resources, and so that's what we're taking to battle. And hopefully prenatal care and child stuff comes along with it. And so I think that's an orientation, at least from a big picture, that can help that reality a lot.
We're out of time.
Yeah, thank you.
I'd like to just ask, do you have any final question for Dr. Lyon? Yes.
Do you think Aristide is going to do anything?
Politically?
Yeah.
I don't know, actually. Aristide is, he's in Haiti, he's sticking around. He basically doesn't leave his house because of security concern, both for himself and for the people who would show up if he did work publicly. He's restarting his medical school. He's committed himself for the indefinite future to be in education in Haiti and work on that set of parameters. I don't know politically. I almost doubt it because he was a reluctant politician. Despite his lightning rod qualities, he was a pretty reluctant politician in the past. But he's back for a reason, and he's 80% of the population still supports that party. Yeah, 80% of the population, the 80% that was excluded from these last elections. So things have not healed recently.
What I'd like to do right now, in the process of thanking Dr. Lyon this evening, there are two words that come to my mind immediately, or a couple of words. One is patient-centered care. The other one is social medicine. So what other words come to your mind in a way to say thank you to Dr. Lyon tonight? Any ideas that we can actually share with him? A summary, a quick, succinct summary of our ways of giving thanks for the impact that he's had on you this evening. Yes.
True global citizen.
Yes, absolutely, absolutely. Other ideas?
Deeply compassionate.
Yes, absolutely. Saint, right here. Any other thoughts? Nobel Peace Prize, right?
We knew him when.
Exactly. Can you do autograph, please? Any other thoughts we'd like to share? Yes.
Not sure what the term would be, but someone who accompanies, especially with the music background, accompany.
Yeah,
Yes.
accompaniter. It sounds great.
I love that. You know, never abandoning the patient or the whole institution, what you're doing, the philosophy, the mission. Any other ideas? Yes.
I would just say like actual structure. I think in all honesty, I think this program actually, it exemplifies what it means to actually begin structure in a country that, you know, really needs it instead of just only their temporary services.
I'm thinking also rebuilding, you know, indigenous rebuilding, you know, from the inside out, very organic. So, any other final thoughts?
Just
Yes.
think, we're trying to capture reality. I mean,
Yes.
looking at this whole picture, we can't isolate anything. We have to look at the whole picture, and that's the reality.
That's it. That don't just operate in slices. Yes. Yeah.
Improvisational.
Improvisation, yes. And somehow it works.
Sounds good.
It's providential in that way. Yes. Well, we'd like to actually formally thank you, and we have a small token of our appreciation, Dr. Lyon. Shannon Meyer would like to share with you. So please join me in thanking you.